Okay. Hi, I'm Donna McDonald, and I'd like to welcome you to a series of educational videos created to help you on your journey in caregiving, whether as a professional or home-based. These videos were made possible by a grant called Functional Aging and Mindfulness for Seniors. Our goal is to establish an extensive framework to target the specific disparities underlying Metro Detroit seniors' social determinants of health by providing increased multiple component physical activities and healthy eating access, social supports and interaction through intergenerational groups, caregiver engagement, and environmental and system level changes. By developing this comprehensive infrastructure, we are creating a culture of healthy aging that will prevent cognitive decline, improve mental health, and reduce physical decline. The first program in our series is Falls and Safety Prevention for Seniors. The presenter is Dana Rizzo, a well-seasoned nurse with over 35 years in the field of nursing, not only in the hospital setting, but in senior living. She has a passion for education. Please welcome Dana Rizzo.
Hi, everyone. Good morning. Thank you for being with us today. The first in the series will be fall prevention and safety. And this is a topic for everyone, seniors, caregivers, everyone. And it's very, very valuable in prevention, which is what we want to do. So here we go. When we're talking about building strength and balance, if we improve strength and balance, that will prevent falls. And the best way to do that, and I'll be showing you that, we're going to understand the link between falls and fractures. We're going to discover the benefits of exercise and fall prevention, assess our own balance. We're going to learn some simple exercises that can help. And a lot of these exercises can be done sitting in a chair. And you want to leave with a plan for improved bone health for yourself. Now, the first thing we'll discuss is posture. Keeping your back completely straight. You want to avoid rounding your shoulders. As we get older, we tend to look at the ground when we're walking, and that pulls our shoulders forward as we're looking down. But we want to always work against gravity, and we want to walk with our shoulders straight, and we want to keep looking straight ahead. You want to keep your spine long and straight. General lifting, you want to always bend from the hips with your feet wider than your hips. You want to hinge or bend at the hips. The new word is hinge. It means bend. And keep your chest lifted, shoulders back and lifted. And I have wonderful pictures of this. And you want to bring the object as close to your body as you possibly can. Even performing daily activities of living, such as brushing your teeth, keep your spine long and straight. Keep your chest lifted, your knees bent, and you want to bend or hinge at the hips. And here we have it. This is proper posture where you're keeping your spine straight. Your knees are wider than your hips. Your hips are bent or hinged. Your knees are further apart. Your feet are further apart, and you move the object as close to your body as you possibly can. This is improper. Improper means they have not bent their knees. They are bending, and there's a curvature of their spine, and the object is too far away. This gentleman is showing us exactly how we have to do it. So when we're lifting laundry or we're lifting groceries, keep that spine straight, bend from the knees, hinge your hips, bend there. Move the object as close to you, or you get as close to the object as you can, and then lift straight up. This makes all the difference in the world. When you're brushing your teeth, it's important too. You want to bend, again, hinge here. You see they're bent here, their knees are bent, the feet are wide apart, and she's standing up straight to brush her teeth. This is even better. Right here, what this gentleman is doing as he is shaving. Again, this is incorrect. See how she's bending her posture here? And there's no bending of the knees or the hips. This is a better posture. Now, if you have difficulty with arthritis, or you've had a hip surgery, it might be a good idea to just have a little stool like this where you can put one foot on it and bend from the hips again, because that will relieve some of the stress and discomfort so you can successfully brush your teeth and keep your spine straight. Posture pictures, here we go. When you're sitting, and just as I'm sitting now as I give this presentation, I'm in a chair that gives me back support. I'm sitting straight with my shoulders back, both my feet flat on the ground. In this second picture is this woman's working on her computer. She's a little bit short, so she's actually got it looks like an old telephone book under her feet to brace her feet a little bit so it doesn't drag on her hips. And again, she's sitting back, and she's even got a little cushion here to help elevate her again. If you're tying your shoelaces, again, this is the proper way to do it. You want to bring that leg up, cross it over, and tie your shoelaces. And she will do that with the reverse leg again. She's preventing her back from bending all the way over to get down to the floor to tie those shoelaces. That would be incorrect because it's causing a curvature of the spine. When you're picking items up, it's a good idea, if you have a steady surface, that you are lifting the object from the floor, keeping your back and spine straight, and bending from the knee, and she's bending from this hip as well. If you are sleeping, if you sleep on your back, it's always a good idea to use as flat a pillow as you can for your head, and then elevate your knees with 2 pillows. If you're a side-lying sleeper, it's a good idea to have 1 to 2 pillows in between your legs as you sleep on your side. The purpose of this, again, is so that it supports the hip, so the hip doesn't drag down, and it puts pressure on this hip all night long and the spine without the pillows. So keeping the pillows there keeps this in a perfect alignment with your shoulder. See that? So that's a better way to sleep. Again, if you're going to log roll to get out of bed in the morning, it's a good idea to turn to your side, remove the pillows, turn to your side, go up on one elbow as you bring your legs down. It's kind of one movement. Go up on an elbow and swing your legs down. And here she's doing it again. And she's even using this arm to help elevate her. And she's in a perfectly sitting position. Now, because most seniors, people over the age of 65, are on medications. In America, the average person is on around 17 medications. But it's a very good idea to dangle your feet like she's doing so that your blood pressure has time to equalize and your body has chance to maintain equilibrium before standing up, especially if you've been sleeping all night. And this just helps your body to regulate itself into for the upright position. When getting out of a car, it's a great idea to swing your legs over and out of the car. Make sure that you've got a good hand on the frame of the car here and on the dashboard. Bring yourself to a standing position, bending again from the hips, bending from the knees, and then standing in an upright position. If you're using a rolling walker at this point, the rolling walker could be given to you right there, or a cane, so that you can actually walk and clear the door so they can close it. Why do we want to prevent falls? Well, if we can prevent falls, it means that we can prevent many fractures. And this is a fracture of an arm. Here's the radius and the ulna. And you can see that these 2 bones are fractured. And this person's going to be in a cast a long time. We don't need that, about 6 weeks. When the skeleton loses mineral density, it's called osteopenia when the bone is thinning, and osteoporosis when the bone has actually become very porous. The structures of the bone become thin and they become unable to bear our normal weight. And it leaves us with bones that are very fragile that break pretty easily. We know that fractures in seniors over the age of 65 occur 2 million times annually. Fractures occur more than breast cancer in people, heart attacks, or strokes in the United States. So fractures are more often occurring than breast cancer, heart attacks, or strokes in the US. One of the important things to remember that as we get older, and I see this in myself, this is an erect posture of a 20, 30, 40-year-old. But as we start hitting our 50s, 60s, 70s, we tend to curve the shoulders inward. We start to round, the neck starts to bend forward because the shoulders are bending forward. And then by the time we're 90 and or 80 or 90, we have a real curvature of the spine. And the problem with this is that we are compressing the lungs. We're not allowing the lungs to expand when we inhale and to recoil when we exhale. So it's very important that we maintain our correct posture because it allows us to breathe better. It also helps our digestive system to have proper posture. And it also prevents falls because this individual is looking down. And when you're looking down, because there's a fear of falling, you are further injuring your spine. And also you can get compression fractures back here as a result of that. So here is a healthy bone, and you can see how beautiful the bone matrix is. It's thick, and you can see where the walls, the bone matrix is very thick. It's got calcium, minerals, vitamin D. It's got all these wonderful nutrients in the bone that make it super, super hard. It's actually harder than concrete. But as we develop osteoporosis, you have porous bones, and you can see how thin this bone matrix is. See how thin the walls here are. And this, if the person falls that has a healthy bone, chances are they're not going to fracture. But if you've got osteoporosis and you fall, because of the brittleness of the bones, you're at greater risk for a fracture. And it also means that you're going to be much slower to heal because your bone matrix is so thinned out from osteoporosis and osteopenia that it's going to take a much longer time for you to heal from a fracture. So we really want to prevent osteoporosis, and we can do that with exercise. Now, again, here's another picture. This is a cross section coming from, this is the hip joint right here. This is the femur, which is your thigh bone. And this is the head of the femur where it connects with the hip bone. And they took this cross section out. Now, this is a solid bone matrix. You can see how beautiful that is. This person has no osteopenia or osteoporosis. Here, you can see where it's very porous, it's very thinned out. This individual has osteopenia and osteoporosis. Why bones break or fracture? Bones break easily when they lose bone mass, as we saw in the previous slide. Normal bone has more density on the left side of the slide, as we noticed that, right? Left side of the slide, more bone density. Low bone density can be seen with osteopenia, and osteoporosis is the picture on the right where the bone mass is reduced, making it more fragile. And here it is. You can see the bone mass is so fragile. You've got osteopenia and osteoporosis here with these big porous locations. Severe osteoporosis can lead to potentially life-threatening injuries, especially in older adults. Approximately 25% of people over the age of 50 who fracture a hip die within the first year of the injury. And this is a statistic that they have been teaching since I started my nursing career 40 years ago. So approximately 25% of the people over 50 years of age who fracture a hip die within the first year of the injury. That's pretty amazing. Now, hip fractures are potentially life-threatening because they prevent you from getting out of bed while you're healing, and there's all kinds of hazards of immobility. Another 60% of the people that have fractured hips say that they are unable to perform common activities such as bathing, dressing, and cooking. It becomes very, very difficult for them. So here we have a hip fracture, and you can see this large fracture. And again, this is the head of the femur or the thigh bone. And this is often where the fractures occur. And again, spinal fractures, because they can also occur. You get compression fractures of the spine with poor posture. And you can see where it's compressing. It not only causes decreased height, you can see the height difference in the person. It causes decreased breathing because you're compressing the lungs. It causes a decreased appetite because if you can't breathe properly, you certainly aren't going to be wanting to eat. And it causes a decreased elimination, which leads to a lot of constipation, hemorrhoids, and other problems. So really maintaining a proper posture is critical and important for your well-being. We know that 1 in 4 seniors 65 and older fall every single year. We know that every 11 seconds, a senior falls, most often in their homes. We know that the falls cost Medicare over $2.8 million annually. And when Medicare has to pay out that money, you can believe that they're focused on preventing falls. There is an increased chance of morbidity, which means illness, and mortality, which means death, with falls. So there's an increased chance of getting sicker and dying with falls. How fractures compare in annual occurrences? Well, we know breast cancer occurs 268,000 cases annually, heart attacks 790,000 cases annually, strokes, CVAs occur 795,000 times annually, but fractures from falls occur 2 million times annually. Medicare is spending a lot of money on these fractures as a result of senior falls. Prevention is the key. That's why you're all here today. We want to prevent falls in our loved ones. We want to prevent falls for ourselves and for our and the people we're taking care of. So fall prevention classes and safety classes have helped reduce these statistics. In fact, many of your states will offer a matter of balance. It's called MOB, a matter of balance class, or the SAIL class. And these two classes are free of charge through the community centers in your area. And they help improve core strength to teach you how to balance your body better and all kinds of tips. And they have found statistically that people that have successfully completed matter of balance and the SAIL class have had lower falls and lower fractures. What increases fall risk? Well, as we age 60 and over, we have a tendency to fall. I've already fallen myself, and I'm over 60. Conditions that affect walking would be things like if you use a wheelchair, if you use a rolling walker or cane. And I know these are walking aids, but a lot of times people trip over them. We know that low blood pressure can cause increased fall risk. That's why when you get out of bed in the morning, you should dangle over the side of the bed, keep your feet low so that your body for about 3 to 5 minutes, so that your blood pressure equalizes, your body stabilizes in the upright position. If you've had previous falls, you're at greater risk for falls. If you have a fear of falling, that anxiety puts you at risk for a second fall. If you have ill-fitting shoes, that puts you at an increased risk for falls. And ill-fitting shoes, you want to really make sure that you have something like a lace-up shoe, a sneaker. Flip-flops are not appropriate. Gaiters, which are those plastic shoes we see a lot in they're water shoes that we see a lot in the summertime. They're not safe because they flop back and forth on your foot. It's important to have very good sneakers that give you arch support and lace up. Poor posture sets you up for fall risks. Poor eyesight. So it's very important that you get an annual eye doctor's checkup and get your eyeglasses renewed, your prescriptions. If you have diabetes with peripheral neuropathy, you're at a high risk of falls. And the reason for that is that diabetes affects all of the nerves in the body, mostly the peripheral nerves in our hands and in our feet. And if you have diabetes, you don't even know from the ankle down, you can't feel where your foot is in space. So you may think that your foot is off the step, and it isn't. It is actually on the step, and then you fall. Same thing as with diabetes, as people pick up cups and glasses, many times they can't feel that the cup is secure in their hand, and they drop it and it breaks. So that's all part of the diabetes. So it's important that you maintain your A1C levels, you stay on your diabetic diet, that you walk and exercise daily to keep that A1C level as low as possible to prevent diabetic neuropathy. And I will tell you that in all my years of nursing, because of all the education that we're doing on diabetes management, that more and more I see doctors writing in the electronic charts that the patient has diabetes type 2 with no sequela, meaning no side effects from the diabetes, because they're so well maintained on diet, exercise, they're taking their metformin or what other drug the doctors have them on, and the diabetes is not progressing. So we have no cure for diabetes, but we sure can control it. Diabetes type 2. Now, we can reduce our fall risk. We need to talk with our doctor about what is our fall risk level. We'll have a handout for you. Monitor your blood pressure and keep a record. Online, if you Google blood pressure records, you can download and print off these little blood pressure record cards. They're very, and you just say the date, the time, what your blood pressure was, and you can indicate that it was the right arm or the left arm. Always use the same arm. Remember that we can reduce our fall risk by going to the doctor, seeking eye examinations annually, correcting the poor vision. We want to correct our muscle weakness. As we get older, our core strength, which is the core of our bodies, it's the abdomen, and it's all of those muscles in the pelvis that tend to get weak. So we can strengthen that through exercise programs. Even if you have arthritis, you can take a water aerobics class. You can go for just a walk, not running, just a walk every day. You want to get as many as 7,500 steps in, because that will reduce your risk of heart attack and stroke by 40%. You want to correct your poor balance through exercise and through programs like we've discussed, and also through the Matter of Balance class and as the SAIL program. Ways to prevent falls at home include on the stairs and hallways, you want excellent lighting. Use strong handrails that are really hammered into the wall. You want to remove carpet from stairs, especially if it's worn out. You want to use neon tape to mark the stairs. And you can buy the neon tape at Lowe's, Home Depot, and Amazon, and you can get it in bright orange or yellow or red, but just make sure it's bright so that you can see where the steps end. Consider a stair lift. They've gotten to be very reasonable and they can be installed. Wear secure shoes. Mostly the lace-up shoes are the ones that have that sturdy Velcro over the top. So this is stairs and hallways. Now, moving on to the living and dining rooms, again, you want secure carpets to the floor. Use cordless phones and remotes like the Roku channel changers. That Roku will change the channels for you. You don't have to keep getting up and stepping over any wires. Cordless phones are a great idea. Use a seat riser or a firm cushion on your chair. And we offer seat risers. You can pick those up at Lowe's and Amazon and Home Depot. And these seat risers or firm cushions allow you to get a better grip on the on your standing position. It gives you assistance with standing, sit to stand. An armchair for sit to stand is necessary. You need those strong arm wrists to get yourself from a sitting to a standing position. Watch out for pets that are underfoot. I have one of those right now. She's getting deaf. She's 13 years old, and she doesn't hear when I say, Nola, move, please. But she'll sleep right next to my bed. And before I get up, if I have to get up to go to the bathroom in the middle of the night, I have to use my foot and rub it over her coat so she feels me, and then she gets up and she moves out of the way. But be careful of small pets or large pets. And again, you want excellent lighting. In bathrooms, ways to prevent falls in bathrooms are to install the grab bars around the bathtub and toilet. And there are companies that install these. I had a very bad experience because as a nurse, I get my neighbors call me when they need help. And they had grab bars. Her father, who's 90, was in a shower seat in the shower. And I was attempting to get him out of the shower, off the shower seat. And the grab bar that he had was a magnetic one or vacuum one. And because of the humidity in the bathroom and the tiles were damp and wet, this darn handrail, as I was lifting him, moved all over the wall. And I really injured my neck and my shoulder. It was poor. It wasn't installed properly. They didn't have the right devices, but there's companies that are called home safety companies, and they can come out and install that, and Medicare may even help pay for it. But you need those grab bars around the bathtub and the commode, the toilet. Use non-slip mats in the bathroom. Get a nightlight. That's important so that you can maneuver. A gentleman that I taught this class to said his family actually bought him a commode seat, a toilet seat that lights up, that it registers movement in the bathroom, and the toilet seat completely lights up so he knows exactly where to sit down. And they said they bought that on Amazon, but he loves it because he even gets different color selections. You want to use a seat riser on the toilets. Seat risers are not all the same. There are some that are very secure and some that are not. But again, research seat riser, look at your consumer reports to see which is the best one. And again, these seat risers can be purchased at Lowe's, Home Depot, and Amazon. In the kitchen, you want to clean up spills immediately. Do not use floor polish because it makes it too slippery. Keep frequently used items close at hand. That means don't put them up in your cupboards, keep them on the counter. Do not use dining room chairs with wheels. Most of us don't have dining room chairs that have wheels. We see that a lot in nursing homes, but you want a dining room chair that has good sturdy armrests and no wheels. Exercise prevents falls because as the muscle strength increases, it protects your joints and your bones. So as you do these exercises to increase your arm strength and your leg strength, it's protecting those joints and your bones. It keeps us flexible. And if we're flexible, it improves our mobility, which means that we can turn, we can bend, we can walk up and down stairs safely and more securely. You want to be aware of your balance and agility, because balance and agility has everything to do with prevention of falls and fractures. And of course, core strength. Core strength enhances your balance and stability because it is strengthening your core muscles in your pelvis, in your abdomen, and in your thoracic region, all the way up. So this is your core, from your neck all the way down the middle to your pelvis. That is your core strength. Now, what we've covered so far is that we know that we have bone loss mass as we age, that our fractures are very common, and so are falls for seniors. In fact, it's the most common injury. Over 2 million annually occur in the United States. We know that taking medicines, and they call it polypharmacy, meaning that the multiple medications may all have side effects that can cause dizziness, lightheadedness. So we really need to dangle our feet. And we know that poor vision increases our risk for falls. We know that there are things that we can do to make our homes and every room in that home safer. We know that exercise can help us prevent falls and protect and strengthen our bones. We've talked about a great posture, stand tall. There she is, head straight ahead, looking forward, shoulders back, stomach in. Their sacrum and your shoulders should be matched up. And there should be perfect alignment right here. Now, if you can suck in your stomach, okay, and I know our abdominal muscles get a little weak as we get older, but every time you suck in your stomach, you are strengthening your core strength, you're improving your bladder efficiency, and you are really helping to your posture and your core strength. This is very poor posture. This, you can see rounded shoulders, shoulders are coming forward, rounded neck, abdomen is tucked out. And again, look at the shoulder is not in alignment with the sacrum. So this is going to put you at fall risk. You're not going to be breathing as properly as you should. You're going to probably suffer from a lot of constipation and GI problems and fall risk. You want to begin at your level and work up. So let's get moving. According to the American Bone Health Association, after the age of 50, we lose 1% of leg strength and 0.5% of bone density every year. So core and leg strength plus balance and flexibility equals fall and fracture prevention. Now, this couple are just strolling. That alone will help you to stay strong and healthy. Let's test for balance. There is a test that's called the single leg stand, and it's an indication of your risk of falling exercise. You want to stand near a chair that has no wheels with your hands on the chair. Lift your foot off the floor. Remove your hands from the chair. Have someone record the time you are able to balance without touching the chair or bringing your foot down to the floor. How many seconds could you maintain your balance? And here she is again. She's got her hand on the chair, no wheels. She's bringing up one leg. She'll remove her hands from the chair, and then someone is going to record, and it's called the single leg stand. And this is a key that indicates what your risk of falling is related to poor balance. If you were only able to stand without touching the chair less than 11 seconds on one leg, you have poor balance. If you were able to stand on one leg, not holding on to the chair, for 18 seconds, you have fair balance. If you were able to stand on one leg, not holding on to the chair, you will longer than 24 seconds, that is good balance. If you were able to stand on one leg without holding on to anything greater than 38 seconds, that is excellent balance. Now, in that matter of balance class, MOB, or the SAIL class, these classes actually are, I think they're about 4 weeks long, once a week, but those exercises will help you so that all of you will be able to improve your balance and get into the good balance range or the excellent balance range. And the classes are free of charge. Again, what is proper body alignment when performing activities of daily living? Remember, you want to stand with your feet hip wide apart, Keep your spine long and straight. Hinge, bend at the hip and bend your knees. Keep your head back and in line with your spine. Here, this woman is working on her computer, or it could even be on an airplane. It looks sort of like that. You can see that her legs are straight, they're not crossed. She's sitting all the way back. She had a small cushion here to help her to maintain that posture. Here is poor posture. People are crossing their legs. This decreases blood flow to the lower legs, sets you up for blood clots. Here you can see where her bottom is tucked in, is curved. She's not sitting straight up, and she is this is very poor posture. And what's happening is that this puts added strain on the spine, so she's going to have a very stiff spine when she stands up. If you are tying your shoelaces and you find it difficult to cross your leg over the other leg, you can use a box, or you can use a footrest to bring that leg up to tie that shoelace. Again, keep that spine long and straight. This is completely wrong. Bending over like that, that's curvature of the spine, and that is going to really hurt her in the long run. Again, in this position, you can see where this individual is hunched over. The shoulders are hunched over. She's got an abnormal curvature of the spine and the neck, and this is very, very unhealthy. Here, this woman actually used a little towel right here. It's called a log roll, where you take a towel and you roll it up lengthwise, and she put that at the small of her back, just to give her back the strength to lean her back, shoulders backwards. So everybody right now, if you're sitting, I want you to sit with the proper posture. Bring your shoulders back and just sit that way with your head back against the headrest for a few minutes, and just feel the relief that that gives you on your shoulders and your lower back. Exercises to perform at home to strengthen the hip and the thigh muscles. These are called sit to stand. And I do this in my office at least 5 times a day. And I'll sit with my feet wide apart, okay? And I scoot to the edge of the chair to prepare myself to stand. My feet are in line with my hips, okay, right here. And I hinge forward. Here's my hip bending or hinge forward, and I keep my back perfectly straight, and I stand up. You want to begin by to sit by hinging at the hips, which they've done, back straight, and reaching hips to the chair. Lightly touch the hips to the chair and stand again. So you want to sit to stand, sit to stand. You want to repeat this 8 times, 2 or 3 times a day. And 8 times, 1 set of 8. And you'll find that by the end of 4 weeks, you're able to do so much more than when you started out. But the sit to stand is going to improve not only your back muscles, but your abdominal muscles and your pelvic muscles and your thighs and your hips. So this is called sit to stand, and this is from the American Bone Health Resource. They have ankle mobility and calf strength exercises, and this is called the toe and heel stretch. And in the toe and heel stretch, it's important that you can stand behind the chair for support, as they're doing here, feet hip width apart, and lift your heels to stand on the ball of your feet. Slowly lower your heels to the floor. There they have it. And then lift your toes. It's kind of like a rocking action. And this is allowing you to strengthen your toes and your heel stretch, and it's also improving your calf muscles. And this toe heel stretch should be repeated 8 times a day. And this can all be done in the privacy of your home, 8 times a day. And again, you're going to find that your toes, your heels, It will help if you've ever had plantar fasciitis, and it will strengthen the calf muscles as well. So this is called the toe and the heel stretch. Okay. And this is your sit to stand. Here she is sitting and standing again. And that's the first exercise we just talked about. Now, this is called standing hip strength and balance exercise. And this is called standing hip abduction. And abduction means to take away. So you're going to stand up straight with a chair, no wheels for support. Shift the body weight onto your left leg and foot. Lift your right leg off the floor with your knees straight and your toes pointed forward. And here we have that right here. And hold your leg out on the count of 1, 1,000, 2, 1,000, and then bring your leg back. Slowly lower the leg until the toes touch the floor again, and then lift again. 1, 1,000, 2, 1,000, and then bring that leg down again, and then bring it back out. And remember to always bring this leg slowly back to the standing position and count 1, 1,000, 2, 1,000, slowly return it. You want to repeat this standing hip abduction 8 times. And this is going to strengthen your hips, which will improve your balance. It's going to improve your flexibility, and it's going to improve the strength in your thighs. Hip strength and balance, standing hip flexion. In standing hip flexion, slowly lift, standing tall, lift your right leg with thigh parallel to the ground. And you can see where she's holding on to the chair, but she's lifting this leg and she's bending the hip. It's the hip hinge there and bending it. Hold your leg out for 2 seconds. 1, 1,000, 2, 1,000. Slowly lower the leg and the foot to the floor. Repeat with the standing on the left leg, alternate your leg, and raise your left leg and hold the count 1, 1,000, 2, 1,000, and then bring it down to the floor. You want to stand with a chair on your right side for support. So you'll have to move from the right side of the chair to the left side of the chair as you alternate legs. Repeat these standing hip flexion exercises 8 times. And again, you can break this up throughout the day. In the morning, you can perhaps do the first set of exercises, which is your sit to stand exercises, maybe after breakfast. Then at lunchtime, perhaps you could do the toe and heel stretch. And then you can do the standing hip abduction, where you're moving the leg out and then back and holding it on a count of 1, 1,000, 2, 1,000. And then you can do the hip strength and balance standing hip flexion, perhaps before dinner. And try to repeat it 8 times. If you can't do 8 repetitions, try 4. And then gradually work up to 8 repetitions. The summary of what we have learned today is that we always want to practice good posture and alignment, always, whether we're sitting in our cars, sitting at the kitchen table, or at our desk. Do balance and leg strengthening exercises every day. Think about and plan for them. That's what I do. Make your home safe and be mindful in your everyday activities. You can even ask the county to do a home safety inspection, and they will send someone in to discuss lighting, removal of shabby carpeting, maybe that's kind of lost its grip and it's shiny. My mother took a fall on that. My sister had very old carpeting and 4 very active boys, and the carpeting took a beating. But my mother fell from the top of the stairs on her bottom all the way down and had multiple pelvic fractures. And removing the carpet would have been a very good thing. Consider a community exercise program. The YMCA offers all kinds of programs, water aerobics, Tai Chi, all kinds of things, yoga. Those are all fabulous in working the mind and the balance and the body. You want to consider a virtual exercise program offered on TV. Exercise can prevent falls and fractures, and it gives your life so much vitality. Thank you so much for attending today. The information for this presentation came from the American Bone Health Association, and their mission is to engage, educate, and empower people to build and keep strong bones for long and independent lives. If you go to info@americanbonehealth.com, you can download the exercises, americanbonehealth.org, and you can get all kinds of great information and exercises from them. Thank you so much. Dana Rizzo, Walton Wood. Walking is the best way to improve your strength and your balance.